Thank you, Roma. That was very, very sweet. And yes, that picture of me was when I was 15 months old or something. People say I haven't changed a bit. Thank you for all coming so early after such a ruckus night. I heard lots about it. I was home at a decent hour preparing. But I want to also say thank you to Dr. Schiffman. This is a perfect segue because I'm going to talk about scandal. But let's see, I do green to go next. Okay, so I'm a scientist at heart. As Roma said, I direct a place called the Mount Hope Family Center that's embedded in a high needs community in upstate New York, a premier research and training center, but also hope is in our mission, right? Hope in healing, for sure, but hope in humanity, especially in trying times. We all know it, we all feel it. The world's changing, our foundations are crumbling under our feet. In many cases, our basic human rights are being challenged. Our funding is going away. There's chaos, sometimes purposely to throw us off our game. But I'm here to offer some hope today. I want to talk a little bit about times of chaos where solutions were at the ready, as Dr. Schiffman pointed out, and we were able to make policy change in times of extreme chaos. Because in chaos, champions emerge. In chaos, in scarcity, innovation is sparked. And we can't take our eye off the ball because we know that in economic downturn, children suffer the most. Research shows all across the board that children suffer during times of conflict. So let me just summarize my whole career in 12 seconds. I've been doing for 30 years basic science, a basic scientist, longitudinal studies following mostly sexual abuse survivors through development, models of how sexual abuse impacts development, and most recently, in the last 15 years, how early life stress, in trauma, in maltreatment, and other forms of adversity impact the stress biology system in ways that stress gets under the skin and begins to impact physical health. I've also proposed models of how sexual abuse is unique, a unique trauma, unique from other forms of child maltreatment, warranting different models of development, different models of treatment, and different models of prevention. 12 seconds, right? Most recently, though, I'm focused on resilience and remarkable stories of resilience, models of resilience, and reversibility of physical ailments that we once thought were permanent. Our basic science is really pointing to some hope there. But I'm not going to talk about any of that. What I really want to talk about is a model of research to policy transformation. This is an empirically based model that we were able to develop as part of the Center of Excellence when I was at Penn State University. And it's really about, it's a model, it's an intervention that teaches scientists to better translate their work into messages that resonate, messages that strike a chord with policymakers. It's also a model that teaches policymakers how to consume science and how to engage in the scientific process. And this model has been shown to work to impact the use of science in evidence-informed policymaking. But the whole idea is that you strike a chord, right? I want to give you an example of how this model has been working in a time of chaos. And I will highlight the scandal. Okay, so Dr. Schiffman talked about scandal as being an opportunity when policy change can happen if you leverage it, and if you leverage it in the right way, and if there are some things already at the ready. This was a football coach, Jerry Sandusky, And in 2011, it was revealed that this football coach had abused scores of young boys in a football camp sponsored by the Penn State University. And it was a huge scandal. Okay, and I was asked to come join the university and start a center, a treatment research and training center. And I quickly realized that the whole community was in disarray. This was like walking into an abused household. Everyone's pointing fingers, right? And everyone was saying, how could this have happened right under our noses? And I quickly realized that there was appetite for change, right? There was appetite to make sense, and there was appetite for prevention. And in fact, it was expected that I would come up with a way to make this stop. So I quickly realized we had our model of policy, research to policy collaboration going, and I quickly realized that I needed to strike a chord with a lot of different places in the community because we needed buy-in. No matter what we were going to do, we needed buy-in, we needed cooperation, and we needed to do what people needed us to do to stop this from ever happening again. So I listened. I listened a lot. I had a lot of conversations. And the first thing I did was I read every transcript. I talked to every survivor. I read everything that I could about these cases and talked to parents and talked to survivors. And resoundingly, parents would say things like, we just didn't know. We didn't know that it wasn't okay for an adult to be showering with young boys. We didn't know how to say no to someone who was in authority over our children. We didn't know what grooming looked like. Teach us. We want to be taught. We want to know what this looks like. Talking to teachers and advocates in the community, teachers overwhelmingly said, Jenny, whatever you do, don't put this all on us. Every time there's a scandal, every time there's something, there's a school shooting, every time there's a bullying intervention, it all falls on the schools and then we have to do it. Don't put it all on us. And if you do, make it efficient, make it short, like do something that we can actually implement, but don't put it all on us. And our local administrators, they said, don't overwhelm our system, right? There were a lot of laws that were passing. Dr. Schiffman just said it. There were a lot of laws on mandated reporting and definitions and so forth being passed. And all of these calls were going to the hotlines and the child lines. And it overwhelmed the system, right? So whatever you do, don't overwhelm the system because no new resources were allocated to this problem. Only new statutes and definitions. And the state legislators, well, they just want to be reelected. They wanted to be reelected by supporting something that actually worked. They said, Jenny, impact the rates of sexual abuse. It's not enough to move policy on just increasing knowledge, right? Increasing motivation. We need to show that something works on a system-wide level. All right, so I had my charge. Make it efficient, make it cost-effective. If we're gonna impact rates, we need to have a large reach. And we were already beginning to learn about multi-sector solutions to sexual abuse prevention. At this time, right about this time, the Together for Childhood initiative was starting in the UK. Right? You learn about that at 9 o'clock today and some other talks. Tomorrow, you'll learn about the multi-sector work that's going on in Jordan. It's very impressive. There are other multi-sector advances happening. And then also we learned from other childhood conditions like lead lead poisoning in the 1970s, which was a huge problem, and it came together as a multi-sector solution that pretty much abated the lead problem in the United States. So yes, I said to my state partners who wanted to work with me, we need a multi-sector approach. They said, okay, you can choose 3. So I said, okay. Children, we want to impact children. We knew that there was an evidence-based program going on in New York that we could adopt that had at least one RCT behind it, and we wanted to use evidence-based multi-sector pieces of this pie. So we wanted to impact children, so we wanted to reach 100% of second graders, these are age 7-year-old kids in every school. Then we wanted the community to be another sector, so we wanted to educate at least 5% of the adult population, and a huge media component, social media, radio ads, TV ads, billboards, all kinds of media. And then parents were the third sector. So we wanted to reach every at-risk parent who was served by the child welfare system in these in the communities that we were working in. So we had a multi-sector approach. They said, okay. Then I said to the state, you gotta let me do rigorous science. If we're really gonna show that this makes a difference, you're gonna have to let me do this county-wide. So in Pennsylvania, there's 67 counties. And I said, let's do it county-wide. Give the money, give the resources so that we can do it county-wide. Because counties in Pennsylvania report their rates every 6 months, and we can track the effects, right? But it has to be a closed system, has to be county-wide implementation where we can track these things. They said, okay. And then I said, I need a counterfactual, I need a control group, I need counties that don't get the intervention and aren't allowed to get the intervention yet, of the same class size, same lots of things that I can put as our counterfactual. And the state said, okay. So off we went. This was just a 3-year intervention. And after 3 years, we got the data. And I had to think differently than I had in all of my 30 years of quantitative methods. I had to think, instead of a psychologist, I had to think like an economist, right? Think as if a policy change has been implemented in a closed system, and use the kind of methods that economists use to evaluate policy change. So I used synthetic control methods. And these are methods whereby you look at trends over time, and you look to see in that time series where you see fluctuations in the time series that are significant. So what you see here is the results that we got. So you can see that this time series is going up and down, right? And you see some kind of fluctuation, right? That's the start of the intervention. Okay. And this line right here, this 0 line, that's the aggregate of the counterfactual counties. This is our control group. This is the aggregate average. So the orange line is the aggregate of the intervention counties. And what's important is that you see before the intervention, the rates were pretty similar. They fluctuated a little bit, but not significantly from the 0 line. But at the time of the intervention, you see a marked change. And in fact, this was significant. And it remained significant throughout the 3 years of the intervention. And there's been some stable change ever since. But this was an important finding, because this really showed that we could think about this as the implementation of a policy change in a closed system. And it's one of the first accountings that I could find of a child abuse prevention strategy that actually changed rates. And this is important. This got published in earlier this year in 2025. And in 2024, there was a U.S. Preventive Task Force report that came out in the same journal in JAMA that said that primary prevention of child abuse doesn't work, that there's no evidence. We needed some hope. We needed some evidence. We needed some traction. Okay? So it's important to show that this worked for valid cases, so substantiated cases of sexual abuse. It's also important to note that it worked for unsubstantiated cases or invalid cases, which meant overall fewer calls to the hotlines. This suggests to us that not only did we teach the community what sexual abuse was, but we taught the community what sexual abuse is not, right? So that there weren't an overwhelming amount of calls going for cases that would not be substantiated, and therefore fewer investigations. Okay? So scan me, because this is behind a firewall, and you can get it today for free because they told me I could use it this way. So this was encouraging, right? It was encouraging to the state legislators. It was encouraging to all of us. But we needed to strike a further chord. We need to translate this in ways that are going to resonate with our policymakers and get traction, because what we really want is continued funding of this to be recognized, not just by Pennsylvania, but other states, of how to do multi-sector interventions and how to evaluate them in terms of policy. So a way to do that, translate. You translated the number of kids saved. Right? So 110 kids did not get abused in this 3-year period. That made me weak in the knees when I did that math. And also there were 320 fewer investigations that happened in that 3-year period. And we can put monetary, amounts to these things. There are cost analysis done of what it cost. Each victim of sexual abuse costs a certain amount in terms of public costs. We know how much investigations cost, so we can back of the napkin do the math on how many dollars were saved because of investigations were fewer. And then we know how much the investment was in this intervention. And when you do that math, for every $1 spent, 14 were saved. And that becomes the message then to policymakers. The other message is public health framework. This is a problem, and I'm going to go to this same paper that Dr. Schiffman was talking about. Please get familiar with this paper, because it does show the prevalence of sexual violence against children is higher than we thought. Right? About 18% of females, 14% of males globally. But an important feature of this paper is that these prevalence rates have not changed since the 1990s. So whatever we're doing isn't working well enough. And we need more work, and we need more cooperation. The other aspect of this paper that I thought was very important is that the countries with the highest prevalence are the richest countries on the globe. And likely there could be some motivation and some resources that could be garnered, that could be coordinated, that could coalesce around this problem if we appeal to those with the most resources. So this is an important feature, I think, of the translation. It's an important feature of how we talk about prevalence, It's also important that we put child sexual abuse and sexual violence in context of other things people care about and spend a lot of money on. For example, these rates are twice what the childhood obesity epidemic is. These rates are 4 times the prevalence of asthma that gets a lot of attention. And these rates are 18 times that of autism. All of these maladies are getting a lot of attention these days, but none of them even come close to the epidemic, the public health problem, the public framework of child sexual abuse and child sexual violence. So I encourage all of you to listen and to translate, okay? So listen to each other, share your expertise, share your knowledge, share your data. Researchers ask the kinds of questions that need to be answered. And policymakers listen to researchers and work together, because that's how we're going to make change. There's a lot of really, really great talks going on today and tomorrow, the policy forum. Go, listen. That's the easy part, right? I'm going to say it one more time. Listening is the easy part, right? Yes, okay. And I want you all to listen, because if you listen really, really, really closely today, right around cocktail hour, listen really, really closely, and you're going to hear the chord that we were able to strike in Pennsylvania. It's resulted in House Bill 460. It will be voted on today. Right? Right. Yes. It's based on this research, right? My compadre's here. Where's Abby Newman? Abby is here? Yeah, Abby, right? Right? We were asked to comment on the legislation. Abby did the hearing. We supported her in that hearing. This will make child sexual abuse mandated in every state or every county in Pennsylvania. And Pennsylvania could become the model state for this legislation to be taken up in other states in the U.S. So listen hard, and I will just leave you with one thing. Don't take your eye off the ball. Have solutions that are at the ready, because this time of chaos won't last forever. I have hope. I have hope in you. I have hope in humanity. Let's share that hope and stay bold during this time. Because if we do, we can deliver a brighter future to our kids. So thank you all for being here. Thank you all for listening. And thank you all for everything that you do to keep kids safe.